say that we are on a par of being extremely concerned about the situation that we're in New South Wales. At least 60 of those were infectious in the community, but that number is likely to go up given a number of cases are still under investigation. Unfortunately, we had 4 deaths overnight, and we extend our deepest condolences to each and every one of the family and loved ones. As I say every day, we read out the statistics, but behind each statistic is a human being with loved ones they've left behind, and our heart goes out to all of them in these tragic circumstances. We had a female in her 40s who was in palliative care. She wasn't vaccinated at Concord Hospital who passed away. A male in his 70s who was vaccinated but did have pre-existing conditions who died at Liverpool Hospital. A male in his 80s who died at Concord Hospital who wasn't vaccinated, and a female in her 70s at Campbelltown Hospital, but we've yet to get further details as her death was only reported very recently, and we'll be able to provide further updates as they come to hand. As I said the last few days, we are seeing stabilisation in the Fairfield and Canterbury-Bankstown local government areas with ongoing decline in growth of cases. And pleasingly, those 2 local government areas have gone from low levels of vaccination to at least 40% of first doses, which contributes to the concerted targeted approach we've had in those local government areas. But the main suburbs of concern in and around Western Sydney and Southwestern Sydney are, and I really want people in these communities to take heed, Blacktown, Doonside, Mount Druitt, Merrylands, Guildford and Auburn, where we're seeing the largest areas of growth. In regional New South Wales, concerningly, Western New South Wales, so Dubbo and the surrounding communities, has seen 26 cases overnight. And it is likely that health advice today will ask us to extend the local government areas in lockdown. Most of far western New South Wales is already in that situation, but there were a couple of local government areas outstanding, and I suspect we'll be getting that advice later today. Hunter, New England had 16 cases overnight. Armidale, Tamworth and Northern Rivers still remain at 0 cases, but obviously health is watching those circumstances, and whilst Armidale still has 0 cases after a week, health has recommended that that lockdown be extended for a further 7 days to make sure that there aren't any undetected cases, given the information health received has changed from those concerned in the first few days of being detected as positive. So whilst those 3 areas have had 0 cases, Armidale, the community of Armidale will be asked to stay in lockdown for at least the next week. Can I say on a positive note that New South Wales has pretty much reached 50% of first doses vaccinated. We know that the lockdown coupled with a strong targeted vaccination program is what is going to get us out of this dire situation. Vaccination is key. Don't wait. Please come forward and get vaccinated. Pleasingly, tomorrow we have around 10,000 tradies and construction workers in those local government areas of concern in Greater Sydney who are getting the vaccine. And during next week, 100,000 authorised workers in those local government areas of concern will be getting vaccinated. And we know that not only will they keep themselves safe and their families, but it will help reduce the spread, because people in certain jobs have to work and they may not have symptoms, but they may have the virus. This is the nature of Delta. It is something we haven't seen before and is spreading in a way we've not seen before. And if we want to stop the spread, we need to get people vaccinated. So thank you to those who've come forward. Please continue to do so, and don't wait for one or other vaccine. Please come forward and get vaccinated. I also want to provide an update regarding the activities of the New South Wales Police. As we stated publicly this week, Commissioner Fuller, the Minister, myself and our team have been in contact about what police need in relation to escalating their compliance efforts to make sure that the whole of government response in relation to compliance is done as adequately as possible across the state. And of course, we note that it only takes a handful of people to do the wrong thing, and I know that the vast majority of people are doing the right thing, and that's a positive. We know that in some of these local government areas of concern, the streets are bare, people are staying home and doing the right thing, but it literally only takes a handful of people to do the wrong thing, to have a super spreading event, an unauthorised gathering, and we have a major setback. And that's why it's so critical for the police to be given these additional resources, and I want to thank Commissioner Fuller and Minister Elliott for their direct involvement in this process. There's two categories of changes in relation to policing that I want to briefly mention before Dr McAnulty will give the health update and Police Commissioner Fuller will then also make comment. Firstly, in relation to police operations, there will be a visible and increased police presence in the affected local government areas, including deployment of specialised commands and including a riot squad, highway patrol and increased presence more broadly. From Monday, there'll be 500 extra Australian Defence officers on the ground as well, following a request by New South Wales Police. There'll be enhanced random checkpoints at key roads with accompanying electronic warning signs so that police have every ability with that increased presence to clamp down on people doing the wrong thing. From Monday, the health orders will be formally enforced from midnight. However, between now and then, police will still be able to impose these additional fines, even though the health orders kick in on Monday morning after midnight. Between now and then, if police have evidence that you're doing the wrong thing in any of these categories, these additional fines will apply. So $5,000 for on-the-spot breach of home quarantine, which is currently $1,000, $5,000 on the spot for lying on a permit, which is already a criminal offence, $5,000 on the spot fine for lying to a contact tracer, which is already a criminal offence, $3,000 on the spot fine for breaching the two-person exercise rule in any way, $3,000 on the spot fine for breaching rules going into regional New South Wales. In Greater Sydney and other lockdown areas, but not the local government areas of concern, the 10-kilometre rule will come down to 5 kilometres. So you can obviously do activity within your local government area, but instead of 10 kilometres from your home, it will be 5 kilometres from your home, and that's for all of Greater Sydney. All those areas which aren't the local government areas of concern will now have imposed on them the 5 kilometres instead of the 10 kilometres. In affected local government areas, we want to stress that exercise means only exercise and supervision of children. So the word recreation will not leave any doubt that word is taken out in terms of those local government areas of concern. Exercise means exercise. Many people know that, but unfortunately some people were trying to get around the rules that were imposed. In affected local government areas, you will need to register your single buddy to make sure that people aren't abusing that rule. And also, importantly, for regional New South Wales, you will need a permit to go into regional New South Wales, whether you're an authorised worker, whether you're travelling to a second home because you might be a worker utilising a second home, or whether you're inspecting real estate. You will need a permit. The permit system will be effective from next Saturday, but obviously between now and then, police can stop you and seek evidence for what you're doing, and if you're doing the wrong thing, you'll have those extra fines imposed. Obviously, we've also tightened the rule, as was foreshadowed, around inspection of real estate property and others where it's limited to one person, and only one person, of course, can travel to a second home. So these are additional resources and additional penalties and tightening of orders in some circumstances to provide police all the resources they need to be able to ensure that compliance is maintained at all times and to ensure that the small handful of people doing the wrong thing are prevented from doing the wrong thing. I'll now ask Dr McAnulty to provide his health update, and then Commissioner Fuller will talk about the increased police presence and the police operations, and then of course we'll take any questions. Thank you.
Thanks, Premier, and good morning, everyone. Just give you an update of the numbers overnight. As Premier said, we've seen a very concerning upswing in numbers for yesterday, with 466 locally acquired cases of COVID-19 reported to 8 o'clock last night. There was one overseas acquired case in the same period. We had outstanding testing results, however, with 129,352 tests reported to 8 o'clock last night. By isolation status of the 466 locally acquired cases, 76 were in isolation throughout their infectious period, 19 for part of their infectious period, and at least 68 were infectious in the community. In terms of hospitalisations, currently have 378 patients with COVID in hospital, 64 are in intensive care, and 29 require ventilation. And again, we're seeing a range of ages, including relatively young people in intensive care. 4 are in their 20s, 6 are in their 30s, and 7 are in their 40s. We have seen an increase in sewage detection in concerning areas of the state, Broken Hill and Ballina and Brooklyn, just north of Sydney. So we're urging people who live in those areas where we don't have identified cases to please monitor very closely for symptoms and come forward for testing at even the slightest of symptoms, so we can find if there are cases in the community who are contributing to these positive sewage findings. So please come forward for testing, help us find and control any further spread in those communities. In Western New South Wales, we're still seeing cases emerge in the outbreak that's affecting primarily Dubbo and Walgett. Public health units are working very hard there to identify cases, work with the community to make sure that people are tested and identified should they be cases. Please come forward for testing. We know that some people wait some days with symptoms before they go and get a test. It's really, really important. Assume it's COVID until proven otherwise. Go and get a test at one of the many clinics around the state if you have any of the mildest of symptoms. Thanks very much.
Good morning, ladies and gents. Thank you, Premier. Thanks, Minister. The New South Wales Police Force will launch Operation Stay at Home Sunday at midnight. New South Wales Police will be supported by the Australian Defence Force. As you know, there are already 300 men and women of the ADF on the ground, and an additional 500 will come online from Monday. During the week, the Police Minister and I approached the Premier about some enhancements to the health order, and most of those were requests that came from the field, the police in the field who were having difficulties getting compliance from some members of the community. The movement, particularly in Greater Sydney, was way too high from our perspective in terms of what we were trying to achieve. And our part in this is to get New South Wales Health ahead of the Delta variants. The fines are some of the biggest fines that I've ever seen, and we will be issuing them as of today. So can I say to the members of the community out there is that you may think that leaving your LGA to train is okay, but it's not. You've got a 5K limit now from your house in Greater Metro Sydney. We will be enforcing that. You do have to carry identification. There's a whole range of other health orders that we can use against you. I closed the first business this morning, a cafeteria at Leichhardt, for 14 days for continual breaches of the health order, and I won't apologise that more businesses will be closed over the next 21 days. The permit system is essential in terms of protecting regional New South Wales, and I would ask from Monday there will be information online on the government website in terms of how to access a permit, and the permit system will come in place midnight Friday next week. I think it's important that those people who have been getting around the orders, taking family vacations to other premises, that is over. The permit will only allow generally one person to travel for what is essential business. Premier spoke about the assets that will be involved in this operation. There are 1,400 men and women in the New South Wales Highway Patrol who now will be dedicated to COVID compliance duties on our roads. You would have seen roadblocks both south and north over the last couple of days, and across Greater Sydney and into regional New South Wales. Expect to see more roadblocks where we'll be checking with compliance. Some of the strongest laws, some of the strongest police action coming. I'm not apologetic. Please don't write and complain to me. We've given ample warnings and cautions. That time has gone. Thank you.
Premier, it's now day 50 of the lockdown. A record number of cases today, 466. Why has it taken you 7 weeks to further strengthen the current restrictions?
It's apparent that when you are dealing with the Delta variant, as we've seen in other parts of the world, you need to take the best advice but also be flexible as the pandemic moves forward. And it's really important for us that when we see a new front, that when we see action that we need to take, we take it immediately and decisively, and that's exactly what we do. It's also important for us to explain every step along the way to the community. And again, I want to thank the vast majority of our community is doing the right thing. And every day I feel the burden intensely of what we're asking our citizens to do. What we're asking our citizens to do has been the most difficult decision of my life and the most difficult decision our government hopefully will ever have to make. But it's to keep our community safe. But I appreciate our community also understands the changing nature of the Delta strain and our ability to move with it, to get in front of it. And the case numbers overnight are very concerning, extremely concerning. We cannot see this trend to continue. And whilst the vast majority of people are doing the right thing, too many people, a handful of people aren't, and that will have devastating consequences because the Delta variant leaves no room for error. If you look overseas, even in communities with high rates of vaccination, they have thousands and thousands of cases every single day. And that's why, for a long time, we've been urging our citizens to come forward and get vaccinated. Vaccination is our key to getting us out of this difficult situation. No doubt you need the lockdowns. I don't resolve from that for a second. But the vaccination, getting our vaccination rates up, will keep people out of hospital, because the important number for us to remember is the number of lives we save, the number of people we keep out of hospital. So I urge everybody, if you have a loved one that isn't yet vaccinated, especially if they're vulnerable, especially if they're active because they have to leave home to work, please make sure you urge them to get vaccinated. I can't say that strongly enough. And I wish we weren't in this situation. I wish things were getting better. But this is the nature of the Delta variant. And I think for some time, we thought Australia was different to other parts of the world, but we're not. And we have to deal with it as best we can, and I know we will. I have absolute faith in our citizens, as I've had from day one. I have faith in all the people that are working together in government with community, even with non-government organisations, to get support to people who need it the most. We will get through this, but September and October are going to be very difficult. At the end of October, we'll have 70% double doses of the vaccine. By mid-November, we'll have 2 doses of 80% of the vaccine to adults. And until that time, September and October will be difficult, as I've said. And the challenge for us is to see how freely and safely our communities can live during September and October. And the key to this, however, is not seeing the case numbers escalate but come down. And a key way to help us do that is the vaccine. But I do want to stress to people, just because you've had your jab, don't feel confident. It takes 3 weeks for the effects of the dose to work in your body. As Dr. McAnulty will say and Dr. Chant will say, it takes 3 weeks for the dose to actually work once you've had it. So don't think that you're immune, you're not going to get it. Quite the opposite. You will still be exposed for at least 3 weeks, and even after then, you still have to act as though you've got the virus or others do. Because when you have a proportion of the community that's not vaccinated, they're extremely exposed, and that's why we're very worried about our Indigenous communities in Western New South Wales. And that's why we asked the federal government to get us Pfizer doses into those communities, and I'm grateful that they did that in the last 48 hours, and I thank them for that. But it's really, really important for us to acknowledge and accept that we need vaccination as a key tool in fighting this. This is literally a war, and we've known we've been in a war for some time, but never to this extent. And I know that we will get through these difficult times. We always do. And I never, ever, ever give up hope that our citizens will enjoy those freedoms we did before the outbreak as soon as we can.
You know you've been in a war for some time then. Why has it taken 7 weeks to get to this point?
I say to the people of this state, we've brought the community along with us every step of the way. We've accepted the best advice, and we've kept people out of hospital and kept people alive and made sure we did our bit in getting as many jabs in arms as possible. Can I say what a great deal of pleasure it gave me to learn last night that in those 2 local government areas of particular concern right at the beginning of the outbreak in Fairfield and Canterbury-Bankstown, we had very low rates of first dose vaccinations. Now we're over 40% in each of those areas. Now that will help us, and those areas significantly have also seen a stabilisation or reduction in cases, and that's because we know now what it takes to have that consistent, targeted approach, local government area by local government area, to make sure that we are dealing with each community according to their needs. Whilst we are one New South Wales and one nation, we know that different parts of our state have different needs, and we have to respond to those accordingly. And I appreciate the patience that people have exercised. I appreciate the frustration, and I also want to let business and individuals know the disaster payments, obviously, you go through Service Australia and that kicks in every single week. You don't need to reapply. And with businesses, I want to give the community an update that the wait times now for getting your application sorted is down to 10 minutes, and you'll have the money in your account within 4 or 5 days. So please know we're doing everything we can to reduce your stress, but we're also asking you more than ever before to protect yourself and your loved ones. These high rates of cases day on day in the past week have demonstrated now that the virus is circulating in higher numbers than we've ever seen in Australia. And we need to make sure that we have as many people vaccinated as possible, because the statistics and the facts are higher rates of vaccination are saving lives, keeping people out of hospital, and at the end of the day, that is the statistics that matters the most. How many lives we save and how many people we keep out of hospital. And that is critical. And we know the vaccination is key to that. There are always in hours of darkness, as we face now, there are always silver linings. And one silver lining is that all the vaccines offered to us in Australia are fighting against the Delta strain very, very well. The vaccine is our major weapon against Delta. We are winning the war when it comes to vaccines and Delta. People who are vaccinated are staying out of hospital, are staying safer and healthier. But of course, if you're vulnerable with pre-existing conditions, you're always going to be more susceptible. And that's why it's really important to make sure those vulnerable in our community, those that are active, we're seeing younger people impacted more than before, and we're doing our best to get those jabs in arms. We're stepping up. Even though the New South Wales government didn't have the responsibility to do this, we've stepped up. We've made sure we've made it our responsibility to keep our citizens alive and as safe as possible. And I just want to thank everybody for responding.
For months now, we've been told that transmission is mostly occurring indoors at homes and businesses. Why are you now cracking down on outdoor recreation? Is there now evidence of outdoor transmission? And if not, why are you doing this?
Look, that was a request that came from police in relation to operational matters. We don't want to see any risk of the virus spreading in any way. And whilst there's no strong evidence about outdoor transmission, in fact, we've not seen very many cases at all, what the health experts and the police both want is to see less mobility, less people moving around, and anything we can do to also support the police in having to have standard rules will help them in making sure they identify those doing the wrong thing. So as much as it is a health issue, it is an operational issue. It's about making sure police have consistency when they're applying, when they're trying to work out who's doing the wrong thing. And also this will mean that there'll be less number of people in certain locations, because even in those local government areas not of concern throughout Greater Sydney, you'll be able to go within your local government area or only within 5 kilometres of your home instead of 10. So whilst there's no strong evidence of outdoor transmission, operationally, we've essentially said to the police, what do you need to do? What do you need to give you greater compliance? And that's one of the things on their list. And I just want to assure the community that not only will the Police Commissioner receive what he wants in terms of additional powers or additional resources, but more than what he needs and wants, to make sure we're not leaving any stone unturned and to make sure that the community is kept safe at all times.
It's been reported that you are looking at a plan for fully vaccinated people to perhaps have some freedoms next month. That may include going to bars, beer gardens, perhaps fully vaccinated people visiting other fully vaccinated people. Can you give people some hope about that?
As Dr. Chant and I said during the week, I've asked her to look at some categories of low risk and safe ways that vaccinated people can interact, but I don't want to raise expectations in terms of hospitality and things of the like. This will relate to other categories where there's low risk, but please know the key to our freedom is 70% double dose, which we estimate New South Wales will be at the end of October. And according to the Doherty report, which is our national cabinet endorsed plan, 80% of double doses will allow us to treat the COVID or the Delta variant more like the flu than what we are at the moment. But until we get 80% of double dose adult vaccination, which is what we've all signed up to, and on the current rates, and New South Wales is doing slightly better than what I tasked, I'm pleased about that. I'm pleased to know there's a high demand for vaccination, and there should be, because we know it's saving lives. And I've certainly let everybody in my life know, please go and get vaccinated, and I urge you to do the same. I don't want my loved ones feeling vulnerable, especially now. And for those who are concerned about their health and safety, please stay home. Know that you'll have every support in the world. If you need anything, let us know. And can I also please stress that in those local government areas of concern, we have non-government organisations working with government through Resilience New South Wales in particular, through Commissioner Shane Fitzsimmons, making sure that non-government organisations are working hand in glove with government, translations in over 150 different languages, dealing with community leaders one-on-one, dealing with people at places where they feel comfortable. We call it a micro-strategy in every single local government area of concern, and I want to thank police for their role in that. They've got their emergency management structures in place, working with social services and whole of government support to make sure that targeted approach is there. And we know the targeted approach is having positive impact. If you look at what's happened in Fairfield and Canterbury-Bankstown areas, not that they're not areas of concern, we're still seeing cases in those areas of high numbers, but certainly the case numbers as a trend are declining. And that's what we need to see elsewhere. The front's moved through to Blacktown and Mount Druitt and Marylands and places like that. And unfortunately, we're seeing cases now in Western New South Wales, which are different in nature, but equally concerning.
Premier, given the support for vaccination, do you support a company like SPC making vaccination mandatory for its staff?
Oh, look, that's a decision for that company, and I applaud any company that's providing incentives for their workers to get vaccinated. Can I say the response we had to the way in which we approached construction, I remember being criticised. Just remind everybody how criticised I was when I shut down that industry, which had hundreds of workers on sites mingling with each other. And I just want to thank that industry now, because the way they've responded is a good model for us to look at in the future. They now have safe work practices, and everybody coming out of those areas of concern has to be vaccinated, and the demand has been extremely positive. The feedback's been positive. People want to get back to work in a safe way. And that has inspired people to come forward and get vaccinated, and I'm pleased about that. I'm really pleased that employers, business is really coming on board. They want to see their workers back. The workers want to be back at work, but we need to make sure it's done in a safe way. The last thing we want is to see these cases continue to increase, but they will if we don't get to those authorised workers, which is why the extra doses that we received brought forward. I mean, every state had some of its doses brought forward, including New South Wales. We're not getting any special treatment. Quite the contrary, we're getting treated the same as everybody else. But what we're doing is making sure we maximise those doses to where it's needed most. And it's those authorised workers that are having to go into other communities because of the jobs they do, whether it's aged care, whether it's disability care, whether it's freight and providing or working in supermarkets. Last Sunday we had a Super Sunday for all the supermarket workers. Tomorrow we have a Super Sunday for tradies and construction workers, and that's critical. We've already had, I understand, 10,000 people register tomorrow. I do want to stress there is a walk-in centre at Prairie Wood. If you're a construction or tradie who hasn't booked anywhere and you don't want to wait long, you can turn up to the Prairie Wood Centre and get a vaccination. So we're pulling out all stops because we know that vaccination is key, and I'm very confident we'll get to the 6 million jabs by the end of August. But I do want to foreshadow, as I've said, the most difficult thing for us as a team in New South Wales, for us as citizens of our state, will be living through September and October and keeping everybody safe until we hit those 70 and 80 doses. And I can't also stress enough that we need to reduce the case numbers. Opening up when the case numbers are so high is a risk, and we need to make sure we reduce those case numbers as much as we can. Our ultimate would be obviously not seeing anybody infectious in the community, but we also have to be real about the Delta strain. And what we've learned in the last few weeks is how virulent it is, but we also know that a shot of the vaccine and 2 shots of the vaccine is our best weapon for every single person in our state.
The Giant Steps outbreak, the outbreak at the Giant Steps School, has there been any more cases associated with that?
Yeah, I'll have to get back to you on that. I haven't been given any updates on what was said yesterday, but I'm happy to get you extra information. Who hasn't asked a question? Sorry. Yeah.
Premier, the permit system doesn't kick in for another week for the regional New South Wales exemptions. Will that allow people to continue travelling to the regions to their second home in that week? And why hasn't the technology with Service New South Wales been made ready for this
Oh, look, the technology is there, but we need to make sure that in a pandemic you put resources where they're needed the most. And police know that they can start booking people from tomorrow with those extra fines. But the permit system will just make the process more efficient. But police will be able to know from tomorrow whether people are doing the wrong thing or not, and you will be fined. But obviously the permit system will be more efficient. It will take police seconds to make sure someone is legal rather than a couple of minutes potentially. So the police have their powers from Monday morning when it kicks in, and even between now and then, to stop anybody doing the wrong thing. But the permit system will just mean it takes less time and is more efficient. But obviously police know, and Commissioner and I had this conversation this morning, that from Monday they'll be able to make sure that they put those extra fines on people doing the wrong thing. But from next Saturday, it will just be quicker for them to do that.
How much pressure?
Is there any scope to allow 17-year-old tradies in those LGAs the same access to the vaccine as 17-year-old HSCs?
Oh, I'm really pleased to say that tomorrow there are significant numbers of tradies and apprentices who are between the ages of 16 and 18 getting the vaccine. So I want to stress that we did prioritise in terms of the type of vaccine, because if you're under 18, you're only allowed one particular type of vaccine. So we have actually targeted apprentices and also tradies and others who are under the age of 18 in those local government areas of concern to come forward and get the jab, but also obviously people older as well. Our critical age for people in those local government areas of concern is between 16 and 39. That is the age group because of their work who are the most mobile, and that is also the age where unfortunately they have contact with two other generations. We know that in some parts of Greater Sydney there are 3 generations living in the one household. So those authorised workers are exposed because they obviously have to leave the home for work. They live in an area where there's a lot of virus, and then unfortunately they come home potentially and give it to the rest of their household. But a vaccine will stop the spread to everybody in their household. It means only some of their household might get it if they have the virus, and of course it also protects them. But we are seeing, at least the last time I looked, in excess of 60% of COVID cases are in people under the age of 40. We know that it's affecting young people. The difference is, of course, the vaccination, and the vaccination is protecting people and it's helping reduce the spread.
So those 17-year-old tradies, they'll be given Pfizer, like
yes.
the HSCs?
Yeah.
Premier, you've lent very heavily, obviously, on...
Sorry, Tom, I can't hear you.
You've lent very heavily on the health advice through this pandemic. You're now taking advice from police, admittedly without any evidence, health evidence of outdoor transmission. What's changed there? Has the health advice let you down?
Oh, can I stress that what the Police Commissioner and I, Minister Elliott, announced today has been in consultation with the health team. The health team has been consulted every step of the way, and please know that from the beginning, I said that phrase again, but from the beginning of the pandemic, we've made sure that we have had a whole of government response. Health, police, our social services, Service New South Wales, everybody has been working together. So every time we make an announcement on behalf of the government, please know that it's a whole of government response. And Health has been saying ad nauseum from day one, anything to reduce mobility helps. Indoor settings obviously are much higher risk than outdoor settings. So whenever the government makes an announcement, it's in consultation with all of our relevant authorities. But of course, when it comes to specific health decisions around vaccination strategy or around local government areas of concern, of course, that's primarily a health issue. When it's a compliance issue, it's primarily a police issue. But please know, every step we take is done with a whole of government perspective, a whole of government responsibility. And that's the way we approach this issue. And I appreciate the citizens of our state understand that. That's how New South Wales has been acting from day one. But I wish we were perfect in all of our decisions. We will never be. I wish we had one secret formula for dealing with Delta, but it doesn't exist. But what we do know is the vaccines, both of them, are holding up really well. People with double vaccinated are staying out of hospital, are reducing the spread, and we know that our micro strategy in those key local government areas is also having an impact. And when I say micro strategy, I mean going down to the communities within communities within communities. The one-on-one work we've done with leaders, hundreds of community leaders, in reaching out to their members, going to places of worship, community halls, expressing things in different languages, making sure that everybody has access to the resources, the support they need, but also the languages or the translations has been key to our role. But obviously in Western New South Wales, the needs are very different. We have very vulnerable Indigenous communities which we're supporting and making sure that we get vaccine available to them as soon as possible.
Given the delay, the current delays in test results, sometimes up to a week now, should the rollout of rapid antigen testing be stepped up, and should it already be in place more widely?
Yeah, New South Wales is the first state through the National Cabinet process that's been trialling rapid antigen testing. We know business is very keen to do that. New South Wales Health has also been reaching out to our suppliers. We do see that as part of our defence, part of our weaponry against the Delta strain that we're currently experiencing. So that is something we encourage and we're supporting. And we'll continue to do so. But we are concerned about the delays in testing because the upside is it's just incredible. I remember earlier on in the pandemic that we'd be excited if we had 8,000 tests a day. We're now getting 130,000 people on average come forward every day. Some days it's been high, 150,000. And that is great, but the consequence of that is processing all the tests. So we are seeing delays of a few days, which is why we have that $320 immediate payment now available. So if people are waiting at home, they have access to the disaster payment if they're obviously out of work, but if there's somebody who is working that's been asked to stay home because they're for various reasons waiting for their results, well then obviously they'll also be eligible for that $320 payment.
Territory counterparts have expressed concern about the current outbreak. How much pressure are they putting you under to go further? How much was that discussed at yesterday's National Cabinet meeting?
Oh, look, I think it's acknowledged that the situation in New South Wales is acute. But that's why Dr. Chant and I were very clear in our language a couple of weeks ago when we said this was a national health crisis. New South Wales is the largest state. Sydney is the gateway to Australia in terms of overseas returns, and we knew that the Delta strain would be extremely difficult to deal with. So the other state premiers clearly understand that, and other state premiers have had to deal with outbreaks in their own states. But it's important for us to know that the formula for dealing with the Delta strain is in large part the vaccination rates. And we know that the more people that are vaccinated, and we've seen this experience overseas, in countries that are familiar to us with 50 or 60% vaccination rates where they have much more freedom than we do, but they are seeing thousands and thousands of cases, but they're seeing less people in hospital because of the higher vaccination rates. And really in time, when we get to the 80% double doses, we will start to count the number of people in hospital as opposed to the number of cases. And I want to stress that point because really what is important for us during the pandemic is to save lives, save health, but also save livelihoods. And it's that balance you need to strike. New South Wales has always striven or strived to make that balance, get the balance right. And it's not a perfect science, and I'm never going to admit that. And I also want to make very clear that the buck stops with me. I'm the Premier, and I have to make announcements and decisions on behalf of the government. And we do that based on whole-of-government advice, whole-of-government consultation, and we are working our way through this pandemic, and we have to accept that this is the worst situation New South Wales has been in since day one. And it's also, regrettably because of that, the worst situation Australia's been in, because when your largest state is so heavily impacted, it has an impact on the national economy, on the health system, and that's why we've been so vigilant in trying to get as many jabs in arms as possible in as short a time period as possible. And I think we have to accept that for a long time, for nearly a year and a half, we were different to the rest of the world. And now we're not different from the rest of the world. The Delta strain is diabolical, and we have to accept and be real about that, to say that even when you throw everything at it, and even in situations in other states where they throw everything at it, cases are still emerging. And that's apparent. This is a really diabolical strain. We have to be real with what works, and we also have to be hopeful, which is realistic. I'm a realist, and that is that when you get to those double doses, and you see that reduction in hospitalisation, you can live more freely. You can do things that other people in other parts of the world are doing. And that's certainly what we're working towards and why we're racing and sprinting to get those vaccination rates up. And I mean this in a heartfelt way. The way the community has responded and the patience that they've lent us in coming forward and getting vaccinated has been outstanding. And sometimes we've let you down. Sometimes we've made you wait too long, or sometimes the booking system hasn't been as efficient as it should. But please know, where New South Wales is concerned, I've always fought to get as many vaccine doses as possible in our state. I've always fought to have a sense of urgency to our program. I remember setting up mass vaccination hubs and other people were telling me, why are you doing this? But this is because we were seeing what was happening around the world. We wanted to make sure we had capacity to get the jabs in arms as soon as the doses became available. And of course, there is no perfect path forward. Are we going to make more mistakes? Of course we are. We're going to frustrate people? Of course we are. But it's a journey we take together. And I feel it every day, and I want to assure people of that. I feel what we're imposing on our citizens, and I feel the fear. Just like everybody else, we all have loved ones. We all have people whose businesses are on the brink, who are really wanting that support. So we're working day and night. And when I say day and night, please know that every member of my team in every agency is working their guts out to support the community during this time.
Just on the singles bubble, sorry, has there been any transmission associated with the singles bubble?
No, there hasn't been, not that we know of, but having said that, what the Police Commissioner and what Dr Chant and what the whole team always speaks about is, whether it's through health or through compliance, is always trying to be that step ahead. We can't predict where things will go, but we can certainly take precautionary measures, and that's why we are taking those precautionary measures.
This today based on transmission in Sydney?
Well, obviously, we have a major issue with the cases escalating, and anything which reduces mobility but also allows police to put their resources where they're needed also helps us. If we know that people have less mobility, they're travelling less distances, it means police can focus their efforts on those areas of concern and in those areas where we know people are trying to dodge the rules. So it's as much about managing resources and getting on top of compliance as it is about responding to the health. Because when you're in a pandemic, even though it's primarily a health issue, it affects every part of anyone's life. It affects every part of government resourcing and services. So when you are in a situation where everything is stretched, you need to make sure you're putting resources where they're needed. So sometimes our decisions will be totally focused on health and wellbeing. Other times they'll be focused on making sure we manage the resources as best we have with our police to make sure the extra 1,400 and highway patrol and everything else are put where they're needed the most. And anything we can do, and I know that means that people in areas where there are very low or no cases are making sacrifices as well. But we are in this together. And no decision from here on in, no decision from day one has been easy. But what we have to do is weigh up what is the best thing for the majority of our citizens. And we know that every decision we take hurts some people, makes some people happy, makes some people very angry. But at the end of the day, I have to let go of what the noise is and just make decisions that are in the best interest of our citizens every single day, knowing full well there'll always be people that say it was too much or not enough. But what we need to do is base it on the advice, base it on what works for the majority of our citizens.
Sorry. You said you're very concerned about Mount Druitt. Does that area now deserve a mass vaccination hub?
Well, I understand from speaking to our health people that we have planned mass vaccination hubs or even mobile hubs where we're going out to the community all across those local government areas of concern. The health website is updated frequently, but please know that if there isn't one in your suburb, there's GPs, there's pharmacists, and there will be one a couple of suburbs away. So I think people will understand that we can't have a mass vaccination hub in every single suburb because it defeats the purpose. What the mass vaccination hubs do really well is get through thousands and thousands of people in a very short amount of time. The GPs obviously can take a bit longer through their in terms of dealing with each patient. Pharmacists can actually get through things quite quickly as well. But the purpose of a mass vaccination hub is to be able to get through thousands and thousands of jabs in a short amount of time. And yesterday we did over 106,000 jabs in New South Wales. Can I again thank the GPs? They've done a huge amount. The pharmacists have really sprung up like nothing. Like, we're so deeply grateful. The Pharmacy Guild has done an outstanding job in stepping up. And of course, our own mass vaccination hubs, our own hospital sites, and also the mobile vax hubs that we have, the pop-ups that we have where we go to a particular community, a place of worship or a hall, let everybody in that community know, come and get vaccinated, and we're getting good responses. And again, I apologise if you've had to wait too long. I apologise if the booking system's been cumbersome, but we so appreciate the fact that people are getting jabs. If we get to that 60% by the end of August, and then the 70% and the 80% as quickly as we can, that is a positive for us in ways that we will all appreciate.
Commissioner Fuller, just on today's announcement, are you happy with where everything has landed? Did you get everything that you wanted that was presented to Crisis Cabinet?
Look, absolutely. The feeling from police, the evidence from police on the ground, that the rorts were around people going into regional New South Wales not for a proper purpose. So we've seen the permit system strengthened in relation to that. The singles bubble, exercise and recreation collectively were excuses that were consistently used for people moving around. The health advice from the start has been about how do we reduce movement. Our advice, our information, our evidence from the ground is that they were the three greatest concerns for us. And can I say, 3 weeks ago I went to the Premier with the Police Minister and asked for stronger powers around masks and the ability to close premises, and I was given that. We asked for 300 additional defence 3 weeks ago. We asked for 500 additional defence last week. There's been a consistent escalation. And if you look at Fairfield as an example, the health response and the police response and the whole of government response has seen the COVID stabilise and start to fall. But the Delta variant is now leaking. We're trying to stop the leak. You can only do that by stopping the movement of people.
We were talking before about SPC, the company who's making vaccines mandatory, and there are reports that the company's being threatened online, on social media, people threatening to contaminate their products because they're making vaccines mandatory. How concerning is that for you, and is there an undercurrent or a level of threat that police are monitoring?
Look, I haven't heard about that threat specifically, but what I can say is that there's a lot of vitriol at the moment online. We're certainly seeing an increase in threats to public figures and others who have an opinion, and I think people need to calm down. There's a potential another worldwide protest coming up, and I would say to anyone again who thinks about turning up, if you thought the police response was big 2 weeks ago, it will be much bigger this time. I understand that people are under pressure. We're all stressed because of COVID, but it is no time to be threatening people online.
In your conversations for Crisis Cabinet, did you recommend a ring of steel or curfews? Did that form part of your recommendations?
Absolutely not. I asked the Premier and the Minister, and I asked the Premier early in the week, let us set a strategy for 21 days that had a law enforcement focus, that would help reduce mobility, that will close the gaps from those people that we felt were rorting the health orders, and that was delivered to Cabinet Crisis. And my understanding is that there was no debate over it, that it was accepted, and I've got the powers that I've asked for. Now, the next 21 days I won't be asking for more powers. I just need to get this right. We need to get the defence on the ground Monday. We need to help the contact tracers with the important work that they're doing, and I honestly believe that we can get New South Wales out of lockdown quicker.
Commissioner, will police be getting tough on this 5K radius? Do people need to carry ID? Will police be asking for ID? How tough?
Yeah, absolutely. We know that people have been rorting the recreation. We know the exercise as well. We have the power to demand information if we reasonably believe that the health orders are being breached, and you have to carry ID and you have to carry a mask as well. So there's lots of things we're asking you to do to get out of lockdown quicker, but police have been taking a community-based policing response, and I do believe in that, but we will be policing much harder over the next 21 days, and I don't apologise for it.
How long are these restrictions in place for?
The orders are generally cut for 90 days, but I don't think that's relevant in this case. We're really focusing on the next 21 days from a police enforcement perspective. I would suggest, like with any of the health orders, is that once we get over this, that they will disappear.
Dr. McNulty, can you give a breakdown of the Western New South Wales cases between Dubbo and Walgett, and are you expecting the outbreak there to grow?
Yes, sorry, Musk. Thanks. So, yes, we're concerned about the situation in Western New South Wales. So the majority of cases are in Dubbo at the moment. There's been a small number of cases in Walgett and one in Wellington. We have the Public Health Unit enhanced, working out there to identify contacts of cases, to make sure the community is safe. And we're just asking the community to be really cautious for looking for symptoms, for following the contact tracing advice, and to keep the community safe.
What's the ICU capacity there? And also, are people who are hospitalised in Walgett, will they be taken to Dubbo or elsewhere in the state?
Look, there's good base hospitals in Dubbo and Bathurst and Orange, and there's a network of care that the local health district arranges. Thank you.
Doctor, can I ask one more question? There's 303 people who we don't know if they're isolating or not. Is that because they're not telling you, they're lying, or you don't have enough contact tracers, or what's the situation?
No, so we work each day, we report on numbers available to hand. We often will do a short contact with the case initially and then follow up with additional information, including details about what their level of contact in the community has been. That process takes some hours often for cases, so we work through it and update it as we go. Thank you very much.